Okay, b'shem Hashem Nasav and Atzliach, we are going to learn a little bit, b'siyata dishmaya, about fertility in Halacha. That is the topic of this year's Shovavim. I'm pretty sure over the past couple of years we've covered quite a bit on pills and procedures. I think we did a couple of years ago. So before we restart the machzer, it definitely behooves us to speak a little bit about fertility in Halacha. So let's go al Seder. The first question when it comes to fertility in Halacha, a couple gets married and they don't have kids right away. And the shaila is, at what point do they start getting nervous? At what point should they start looking into different doctors, going to the doctor, asking questions? This is a very basic shaila that comes up, whether you are recently married or you have kids that are recently married. This is definitely something that is a shaila. Well, at what point do we start checking into the fertility topic? So it's very important to know that statistically, this is something that people do not know. Statistically, on any given month, what are the statistics of a young, fresh, fertile couple that everything is working 100%? What are the statistics that they should get pregnant on during that month? The statistics are somewhere in the 20%. The way the cycle works, the way the fallopian tube picks up the egg after ovulation, and that the zera has to fertilize that egg exactly at the right time. It's only there for 24 hours, 12 to 24 hours, that it's available to be fertilized. So there's a very short time span that has to everything work out perfectly. And memela, on any given month, there's a 20-25% chance of a couple getting pregnant. Only over an entire year do we say that if everything really is working perfectly, do the percentages go up much higher to the 80-90%. So less than a year, there's not even a reason to be worried. Sometimes you have couples, they're married for 6 months and they're panicking, what's going on? No reason to panic, there's no reason to even worry before a year. Most poskim do say that before 2 years, there's no reason to go to a doctor, to start asking questions. Just let the Eibishter do his thing, so to speak. Obviously, if the couple knows that they have an issue, right? If they know going into marriage that they have an issue, then they should deal with that right away. They shouldn't wait 2 years if they already know going in that there's an issue. Now, when a couple is dealing with infertility, whether it is they just got married and it's 2 years and they taka, nothing doing, or sometimes what we call secondary infertility, which is they're married, they have 1 or 2 children, or 3 children even, and then suddenly they just realize that they've been trying for 2 years, 3 years, 4 years. We have a few, that I'm dealing with now that it's been already 4 years, and it could be just as difficult and then painful. So, what is the percentage-wise? According to the numbers, it's equal. It's 30% that it could be an issue with the woman, and 30% it could be an issue with the man. 30% that it's both. And 10% unexplained. That is the official numbers that they give. But that being said, so checking the woman for different fertility issues includes blood tests. That would be like step 1. Then there are more, we'll call it invasive procedures, which include what's called an HSG. HSG is when they insert dye into the uterus and simultaneously they take a X-ray of the uterus, I usually would have a screen with a presentation showing what each procedure we did it when we did the actual procedures in halacha, what's mitam and what's not. But so again, this is a procedure that again it's a little bit invasive. It's not terribly invasive, but the shaila is, at what point do we check the zera? Checking the zera of the husband is what we would call a halachic shaila, right? Because we have to get the zera. How do you get the zera from the husband? Right? Is an issue. We know you're not allowed to stam be mitzi zera, right? And there's a big issue speaking about Shovavim, right? The zera levatala is one of the things that we try very much to be mesakin during Shovavim. And at what point is it mutter? How do we do it? Right? This is something that has to be discussed halachically. So first of all, like this, we start checking the woman with the basic blood test, what's called hormonal levels. So we'll check her hormonal levels, just make sure that everything is working properly on the hormonal side. If she has an issue with the hormones, then there's no reason b'chlal to check the husband's zera. If you already see that she has an issue that needs to be dealt with. If you check the hormones and everything is taka okay, before we jump to do anything invasive by the woman, we should check the zera from the husband. So how do you taka check? Halachically, how do you check the zera from the husband? So Rav Moshe has a whole thing about what's called niyaf biyad. He's very makbid that zera should never be taken out biyad, even if you're doing it for not levatala, like this l'chayra, right? The first step is the tshuva tzachiyazah that says that when zera is being taken out, the whole isser of zera levatala is when you're doing it right for no reason. If a person is taking out zera to be checked for fertility, or later on, as we'll speak about, when a person is doing fertility treatments and you need zera for the fertility treatments, right? That for sure shouldn't be levatala. Right, so there's a tshuva tzachiyazah that speaks this out in Ferish, that taking out zera for the purpose of having children, even checking to see that the zera is okay, is not called a zera levatala. The thing is that Rav Moshe still has a hakpada that it can't be done biyad. That's called niyuf biyad. That is not something that we do. And therefore, how? So how do you get the zera? So what is accepted amongst the paiskim, in general, is to use what's called a halachic condom. So what you use is really a sterile condom, right? Not the ones that they sell in the stores. Again, a condom is basically a sleeve, like a rubber glove that goes on top of the aver, and tashmish is done with that sleeve, and the zera will go into that condom, and then you take that to the lab, and they could check it. They could freeze it and use it for IVF. We'll speak about the different fertility procedures that are done. So when you gather, again, this is done derech tashmish, so it's not what Moshe would call niyuf biyad. Technically, it would still be haitzah zera levatala if it weren't for the fact that we're being mighty the zera for checking to see that there's no issue with the zera, or then using it for fertility purposes. It would avada be an issue, right? Using a condom in general is usher. Over here, because we're using it only to get the zera to a lab, that would be mutter. So the reason why it's called a halachic condom, so first of all, it's sterile, meaning the ones that they sell in the store usually have spermicides and all sorts of other things in them that would make it useless for our purposes. It has to be one that you get from the lab. It's a special one that you get from the lab that is meant for gathering zera. Also, Rav Shlomo Zalman writes, what we call to do a halachic is if you do a little hole not at the end, but somewhere in the middle of it, a small little hole, a pinhole, in order that it shouldn't be considered a psik reisha that zeras can't go into the isha, and like this, it's there's definitely a mila to use that. Halacha l'maisa, I was makabel from my Rabbi Berkowitz Shlita. in Eretz Yisrael, that he said that, again, yes, that we have the Achiezer, that you are using this for, it's not Levatala, using it for having children. And Lamaisa, where Rosh Zalman writes to put the hole really doesn't do much. So he said it's not really necessary. If somebody wants to, do that little extra, whatever he can, but just make sure that you don't end up messing it up, because you want to have the full specimen to be able to give to the lab. So therefore, I would recommend, unless you know exactly what you're doing, you're better off leaving the hole out. Now, that is legabe getting the when to check. So we would first check the woman for regular blood test. Then the next step would be to check the zera from the husband. Now, there is one thing that is very common, that is important to speak when we speak about infertility, and that is what the doctors in Eretz Yisrael have called akarut hilchatit, or that is a halachic infertility. It's kind of a little shtachi, to the us that are Shomer Halacha, but the name stuck. And what does that mean? So a family that's Shomer Tahara, right? If she has a cycle that is less than about 24 days be'erech, or 25 days, again depending. So let me explain what's going on here. A woman will usually ovulate 2 weeks before she gets her period. Before she gets her cycle, 2 weeks before that, that's when she is going to ovulate. So let's make a cheshbon. If she's going to the mikvah, right, 5 days, right, and then 7, 5 and 7 is 12. So she's going to mikvah, earliest she could go is usually day 12, right? Now, if she is getting her cycle on day 24 or day 25, right, which is berech, right, 12, 13 days later, that means that it's less than 2 weeks, right, from the mikvah till she's getting her cycle is less than 2 weeks. It is very, very possible that she is ovulating before she goes to the mikvah. If a woman ovulates, this is scientific fact. If a woman ovulates before she goes to the mikvah, right, again, we said the egg could be good for about 12 to 24 hours. So if she ovulates a full day before she goes to the mikvah, it is physically impossible for her to get pregnant. This is a pashut scientific. It's not physically possible because she can't get pregnant, right? Because by the time the zera from the husband comes in to her guf, the egg is not there anymore. It's not physically possible. So for Goyim, this is not a problem. Somebody that's not Shomer Tahara, whenever she ovulates, that's when they're going to be together. But for a family that keeps Tahara, this could present a real issue. Now, if you look in the earlier Paiskin, they speak about all sorts of kulas in how do we get a woman to get to the mikveh earlier, right? So there's a kula, maybe not waiting 5 days, maybe shortening it to 4 days, right? That would be one way. The chaperon, another. Sometimes that's all you need. All you need is 24 hours. That could do the whole trick, right? Sometimes it could be a kula. Rav Moshe has a whole thing about Rav Shlomo Zalman. So one of the Chaim brings down, if a woman doesn't go, if she has this is only going to work, she has very short periods. Let's say she only bleeds for like 2-3 days. A woman that only bleeds for 2-3 days, she doesn't go to a mikveh for the whole entire month, right? And then next time around, when she gets her cycle, as soon as she finishes 3 days, she could already make a hefsek, and then it'll be 3 plus 7, and then she could, she gains 2 days like that. It's shaykh to perhaps gain 2 days. So these are all patentum to get around that fact that she's ovulating before she goes to the mikveh. Now, Baruch Hashem, Aksher Dara, nowadays these doesn't exist. These kulas and eitzes are not necessary. B'chlal, modern medicine has figured out how to push off a woman's ovulation very easily by giving a little bit of estrogen pill at the beginning of a cycle will push off a woman's ovulation. It works very, very nicely. there's been studies about this. We had the Dr. Holzer, who was in charge of the, at least when I was in Eretz Yisrael, he was in charge of the fertility unit in Shaarei Tzedek Hospital. So he had done, before that he was in Montreal for many, many years. He was the head of the fertility, the women's clinic in the hospital in Montreal. And he said that, all the doctors that were dealing, the Geisha doctors that were dealing with the frum community there would come to him and ask him, what's the recipe, the special recipe for pushing off ovulation? Again, by Goyim doesn't exist, but for Yidden, when you need to have an eitzah, how to push off ovulation, so they would come to him with what's the special recipe to push off the ovulation. So again, there's medication that could do it. If that doesn't work, there's a little bit stronger medication, but there is pills that you could take nowadays to push off ovulation. This should never be an issue. But this is something that a couple that just got married, or at any point during their life cycle, if they see that that she is getting a cycle less than 26 days, 25 days or less, then she should, they should at least be tracking, at the very least, be tracking ovulation. How do you track ovulation? So a little bit before she goes to the mikvah, a couple days before, there's these little sticks, the same as pregnancy sticks. They're called ovulation sticks. And you basically, it's a urine test, and she'll know when she's ovulating. And this is the mahalach to know, and she'll see if she gets a positive 2-3 days before she's going to the mikvah, then she's obviously missing ovulation, and she has to go to a doctor and get the medicine. If she's dealing with a Geisha doctor, then there's the Tahareinu hotline. Here's the plug for a wonderful organization called Tahareinu that has a hotline currently answering, 4,500 shilas a month or more worldwide. This is just practical medical advice, not really halacha. It's not a halacha hotline. This is a hotline for women that have staining issues, these types of issues where, what's going on with my body? How could we explain to the doctor that this is what's happening, and it's affecting tahara, it's affecting fertility, v'chulei v'chulei. You could get a lot of practical good information. It's women advisors. They're not paskening halacha. They are just giving practical medical advice, what pills to take, what to speak to about the doctor, just to explain to a woman what's going on. And it's a very good resource to have. I believe the number is 1-855-4-TAHARA. Easy enough to remember. And so moving on. So that is regarding a woman that ovulates before she goes to the mikvah. Okay. So now let us talk a little bit about fertility treatments. When we speak about fertility in halacha, there's fertility treatments that are done. The very first thing that usually doctors will do when a couple can't get pregnant, and they're going into past medication, into different procedures that can be done. The first one is called IUI. IUI stands for intrauterine insemination. Intrauterine insemination is basically when they take the zera from the husband. How do they get the zera from the husband? The same way. They're going to use a halacha condom. They're going to get zera from the husband. Then they take that zera, they take it to a lab, and they wash it, and they clean it, and then they put it into a syringe with a catheter, a long catheter, like a long tube, and that tube is inserted inside isomakam of the woman all the way into her uterus. So like this, it bypasses, a lot of times what can happen is that the environment in isomakam of a woman could be very detrimental to zera. And so it could be that that's the issue, that the zera just not making it all the way in to be able to fertilize the egg. So the first step that they're going to do, they'll usually do a couple of cycles of this, is called IUI, where they're going to squirt the zera that was cleaned and prepared in the lab, and then they're going to put that in directly into the uterus of a woman. And like this, they're hoping that that's going to bypass and she'll be able to get pregnant like that. So let's discuss a little bit about the halachic shilas that could come up over here. So number one, let's talk about psichas hamakar. We'll squirting this zera in. So we already spoke about getting the zera, right? That's being done with halachic condom. Will this insertion make a woman tamei? Right? Because they're going actually into the uterus. You're going into the makar. So the halacha is that whenever you open the makar from the outside, it makes a woman tamei. That's why there are certain procedures that are done that make a woman tamei, just even if there's no dam whatsoever. Just the fact that something went into the makar makes a woman tamei. So the question is, how big of an opening do you need or big of an instrument do you need in order to make a woman tamei? So this is a big machlekes of paiskim. In Eretz Yisrael, they're actually machmir all the way down to 4 millimeters. Anything over 4 millimeters, some say 7 millimeters. Anything in that range would be metame a woman. Rav Moshe is actually pretty makel. He says that you have up to 19 millimeters. Now, the catheter that they use is under 4 millimeters. It's very, very thin. And the reason for that is because anything thick that you stick inside could be very, very uncomfortable, very painful. Right? That's why it's psichas hamakar is a very uncomfortable thing. So therefore, the derech klal, there will not be dam. Usually there shouldn't be any dam. And it's not a psichas hamakar. This catheter is under 4 millimeters, so putting it inside is not going to make a woman tummy. Another shaila is, so this is...
makar usually closed or usually open?
So the makar is usually open around a couple millimeters. Every woman is different. Also depending on the time of the month. During when a woman ovulates, it slightly expands a little bit. But it's not mamish always closed. So the makar, the way to describe it would be like a donut. Like a donut with a very small donut hole, because that is the cervix, right, which is the entrance to the actual pear-shaped uterus. So
it is called opening it. It is opening it to 4 millimeters, but
so lav dafka,
not full opening.
right? So lav dafka, will it actually be opening anything? Could be. I mean, it could be opening a little bit. But it's not called a psicha exactly. It wouldn't be called a psichas hamakar. Now, halacha, again, according to Rav Moshe, you have up to 19 millimeters. But, even those that are machmir for anything over 4, this would be under 4, and therefore, halachically, not a problem at all. Even if you're right, technically, it would be fully closed and you're opening, halachically, that wouldn't be considered a psichas hamakar. Correct. Very good. There's a very interesting shaila, and that is, what if a woman is a nida, right? What if she's a nida? So, and that's when she's ovulating. So they got the zera from the husband. Let's say they froze it. They have zera from the husband. From different time, it's frozen, whatever it is. It's ready to go, right? And they check, okay, whenever she ovulates, that's when we're going to put in the zera into the woman, right? When she's ovulating. So we track her ovulation. They usually do an ultrasound towards the beginning of the month. Okay, come back in a couple of days. We'll check again with the ultrasound. And vayhi hayayim, they see that you're about to ovulate. What's going on? What day is it? It's day 10. She's ovulating early. She's still in nida for another 2 days. Right? She didn't get to the mikveh yet. Could you put in the zera while she's in nida? That's a solid question. Mitzad echad, what's the big deal? There's no bia, there's no isser, there's no maisa isser over here. Mitzad sheni, I don't know. What if she gets pregnant with this zera? We know Chazal tell us that a ben nida is right, one of the teisha midas, right? There's 9 different children that are born from different situations. One of them is a ben nida, which officially has terrible midas and things like that. It goes mamish into the neshama. Who wants to have a kid with a neshama that's a ben nida? You don't want that. So what's going on over here? Is it mutter or not? That is a pretty solid gishmak shaila. So like everything else, of course, it's a machlekes, a paiskim. They say b'shem Rabbi Yashiv that he was machmer, better not to. And they say b'shem Rav Moshe that it's completely okay. And the reason for that is because even the whole Ben Nida is only the Maisa Isser. That's what creates a Ben Nida. Ben Nida is because it came through a Maisa Isser. Over here, there's no Maisa Isser. The Zera was taken out beforehand in a mutadik way, and now it's being put in with a syringe. So the fact that she happens to be a Nida is really not a problem. Again, Halacha l'maisa, you could ask. Everyone should ask their own local paisek. But the pashtus, shouldn't be an isser. It shouldn't be a problem because again, the ben nida issue is dafka through a maisa isser.
Why we just give her Dr. Holtz's recipe?
Yeah, you technically can. Usually when they're doing these types of things, they are giving her different medications sometimes to help boost her ovulation. So it could be just a matzav where she didn't get to make a hefsek till it could be it's day 12 or day 13 even, but for whatever reason she was staining, she didn't get a clean bedika. Like a whole host of things can happen, and that's why it's such a big lachat stafka. Because let's say it was day 12 or 13, but because they sometimes they'll give her like a extra shot of gonal, like different medications just to boost to make sure that it's it's very expensive. Such a IUI could be many thousands of dollars. So the doctors will try to do whatever they can to make it really to make it stick. So what are you going to do? She already took all this medication. She's pumped up with medication. She's ready to go. Everything is lined up perfectly. The only thing is she happens to be, not going to be going to the mikveh for another day. So do you push it off or not is taka very serious. Otherwise, you say just wait till next month. It's not so push to wait till next month. She took the medication. They prepared the zera. It's ready to go. It's unfrozen. You can't freeze it anymore. Like there's a lot going on over here that you taka. There's definitely a big makam lahakam. One other very, very interesting thing that a lot of people I don't think about, and that is, let's say you are, going to be meko and squirt that zera in while she's a nida. Now, there's a halacha called piletes shechva zera. So this needs a little bit of the 2-second akdama. Why do we wait 5 days before starting shiva nakim? Huh? Sedation. But I'm saying the full 5 days is. We're saying in general. Why do you wait anything before? Right? What's the vart? Right? I'll pull it. Right? In other words, while a woman has zera inside her, right? While zera is only good for 3 days, right? Zera is good for 3 days. So how do you get to 5? Right, that's the whole shaila. Shkia, right? Maybe it was before shkia. There's a lot that was tacked on to get to 5 days. Me'ikar adin, shechva zera for 3 days is an issue, right? Now that means that kol zman that zera is coming out, she cannot make bedikas. Bedikas are not worth anything while she is a poileta shechva zera. So what happens if we insert zera, right? There was no bias isser over here, right? The Bais can speak about what happens by mistake. They were together, right? So you have to restart shiv and stop shiv and akim. How does it work? But over here, right? So she's in the middle of shiv and akim. You put in zera in a mutadik way, but now does she get a din poileta shechva zera? That's a very fascinating question. So halacha l'maisa, one should be machmir. One should be machmir to now wait an extra 3 days and only continue shiva. She can continue then, but she should continue shiva nakim only after 3 days. These 3 days do not count for her shiva nakim because if possible, that is the right thing to do. At least that was what I was makabel. It is a machlekes a paiskim. I was makabel from my Rabbi Yitzchak Berkowitz that it is kedai if shayach to wait the 3 days and give her a din of poileta shechva zera. Now, let's move on to IVF. You have what, 10 minutes? Yeah. So the next question is like this. What is IVF? So this is IUI. Sometimes that works and Baruch Hashem, a couple will have a child that way and they don't need to move on to the next step. If, unfortunately, that doesn't work, the next step is going to be what's called IVF. What does IVF stand for? In vitro fertilization. In vitro fertilization is when they take, over here all they took was the zera from the husband, and they squirted it directly into the uterus, hoping that that will be enough. If that wasn't enough, now the next step is going to be they take the zera from the husband, again the same way with the halachic condom, and then they take an egg from the wife, right? What does that mean? Again, so how does this work? Every month, right, when a woman goes through her cycle, so her ovaries produce usually one egg, b'derech klal, right? That means that a whole bunch are stimulated and they start growing. At the end of the day, one egg is going to mature, and that inside that egg, inside that it's really a follicle. It's called a follicle, and inside the follicle is an egg that, when the follicle opens up, it'll release the egg, and that's what's called ovulation. And that egg, again, we said, has 12 to 24 hours where the zera from the husband could fertilize it. Now, what they're going to do by IVF is they're going to insert a needle through, they're going to insert a needle into the woman and go, where are the eggs? The eggs are in the ovaries. So they're going to go and they're going to, with the needle, they're going to, like a vacuum, they're going to vacuum with that needle eggs, mature eggs, and they're going to take those eggs and they're going to fertilize them in vitro. In vitro means like in the lab, right? In a little dish, right? They fertilize the eggs and they take those eggs. Once they see that the egg is it turns into an embryo. So a fertilized egg will grow into an embryo. Once you have an embryo, which is basically, so it takes 10 days, 2 weeks, something like that, where there's a machine called the embryoscope, where they have like a whole bunch of little fertilized eggs, and they can watch them grow, because you don't want to chop it with the air or anything. So keep it closed, and so there's a camera on each one. It says mamash the flies of butter to see it, and you see how the cell splits and splits again, and it turns into an embryo, and that is once they have an embryo of the size that they could put it back in, they'll take that embryo and then they'll use the same catheter that we spoke about before. That's not going to be a psichas makar, and they're going to insert the embryo into the uterus, right, and hope that the embryo is going to attach itself to the uterus. And that is how a regular pregnancy works, is that the embryo, when it's fertilized, usually an embryo egg is fertilized in the fallopian tube, and it travels for about 10 days, and then it implants itself. It's called implantation, and it plants itself into the wall of the uterus. So in this situation, instead of it being fertilized in the fallopian tube, we fertilized it in the lab, and they're going to take the one that they feel looks the best, and they're going to put that back into the woman. So first, just halacha, the egg retrieval. The way it works is they stick a needle into Isar Makam. They do not go into the uterus. If you can imagine like a pear, right, which is the uterus, and then the fallopian tube, right, it's like the two, like two horns type of thing, right, and at the end of those are the ovaries. So the ovaries are kind of on the side of the uterus. So if they're going through Isar Makam, and they're not going to the uterus b'chlal, they make a hole with a needle. It's a tiny little incision, and they go directly to the ovary, and they're aspirating the eggs. Now, usually before they do this, they'll give a woman medication to make her ovulate many eggs, right? They want to get as many as possible. So even though a woman usually will only ovulate one egg, when they do this, they give her strong ovulation medication to really try to get her as many, because they want to retrieve it's not a comfortable procedure. They want to try to get as many as shayach, so they can take as many of those eggs and fertilize them with the zera from the husband. So this procedure is not metame. There will be a little bit of blood because they're going, they are going into Isar Makam, so it's metame. It's not metame. They're not going into the uterus, and there's no psichas makar. They're not touching the makar. They're not going into the makar. They're not going anywhere near the makar. They're going on the outside of the makar. They're going through the wall of Isar Makam, and getting to the ovary and aspirating eggs from there, and they're going to use those to fertilize the the zera from the husband to fertilize those eggs.
Like how many eggs do they get?
It could vary anywhere between 3 to 10, like depending on. It could be more again, depending on how she took, how she takes to the medication.
Maybe
More
they should put 2 or 3 back in.
what?
Maybe they should put 2 or 3 back in.
Sometimes they do it. It depends on the situation. Multiples is a whole parsha in itself. So it depends on the doctor, depends on the procedure. Every place has their own guidelines, what they're allowed to do, what they're not allowed to do. Also depends how many they have. If they only have 3, 4 embryos, they're going to try to do each one separately and get the best chances. If they have a whole bunch, maybe for another cycle, meaning
Put a whole nother cycle for that also?
yeah, to put one in, it has to be at the exact time, right? When they take it out, they're not putting it back in right away. They're usually going to wait till the hormones calm down, give her other hormones, make sure everything is perfect, and put it at the exact time that it has to go in. Yes, they're frozen. The embryos are frozen, and they're used, when needed, when is a shots kaisha, we'll call it. Now, okay, so the egg retrieval is not metame. Yichus, right? So how does it work with yichus? So this technically it didn't come al yidei regular bia, we'll call it. So the poskim all speak out that avada, if they're using the regular zera from the husband and the egg from the wife, then we consider this 100% yichus. If the father's a kayan, the kid's a kayan, everything is 100%. That's how we treat it as regular yichus. Now it's important to speak a little bit about hashgacha. There are crazy stories. If you just look it up, Google it, whatever, from a Malakit Saitan. This is going back already many years when they were building the whole IVF musag, and each doctor was trying to prove how it works, and it's so matzliach. So there's crazy stories of doctors that were using their own zera to fertilize everybody's eggs. Like there's a doctor that has like 80 kids. I don't know, crazy myson. So obviously that caused a huge rash. And when you see the poskim speak about IVF, this was always a very big issue to deal with. How do you know, right? How do you know that everything is okay? How do you know that they're using the right zera? How do you know they're using the right baits or the right egg? Like it's a scary thing. So a lot of the poskim that speak out, I don't want to say against IVF, but are cautious with IVF, this was a big deal by them. L'maisa Baruch Hashem, nowadays, there's 2 things that really changed a lot. First of all, nobody's trying to prove really that IVF works anymore. That is, it's been established, it works, and most doctors, again, everybody, I guess, wants to have good numbers, but at the end of the day, another huge thing that happened was DNA testing. Nowadays, you could test the DNA of anybody, and this is how they found out. Right, at the end of the day, how did they find out? They were testing these kids' DNA, and they saw that it wasn't the father. The father was all the same person. So nowadays, there's DNA testing. So memela, there's what's called a mirtas. There's a big mirtas that, which means in English that the doctors are afraid to really play around with the system, right? Almost like Rav Moshe's Chalov Stam thing, right? That that the government is very makbid and controls what goes into the milk. So that no one's interested in playing around with the government, and the assumption is that the milk is Chalav Yisrael. So, or not Chalav Yisrael, the milk is Chalav cow and not some other treifa Chalav. That being said, Baruch Hashem, Achsher Dara, and there's wonderful organizations that Bein Olam and Pua and again different cities have their own branches that do a hechsher, and basically what they do is they'll have a from Yid that goes to the lab, and everything, whenever they touch anything that has to do with this couple, there's going to be a yid there that's going to double check to make sure that it's otherwise it's on the lock and key. And when it's not on the lock and key, they're checking to see that the samples that they're using are the ones that are marked with his name and her name, and like this, everything is done outside hayaser type. What to do when hashgacha is not available. Again, that everyone should ask their own shaila. But Baruch Hashem, I think across the board, it's in most big hospitals, big areas where, for sure, in the Yiddish areas where there's a concentration of Yidden, these wonderful organizations have really ensured that you can get a proper hashgacha, and that is definitely important to do. And I would even add that sometimes, the hospitals have protocols, but they also don't want mistakes to happen, but mistakes happen, and having that extra layer of hashgacha is always ratzui, just to make sure that even if it wasn't maliciously, we spoke about a doctor maliciously using his own or whatever, even if not, mistakes could happen, people are tired and whatever it is, so when you're using hashgacha, when you have hashgacha available, avad that should be used to ensure that no mistakes happen either. I would end with two interesting shailas, la halacha. Number one is what to do with the leftover zera. Let's say a couple, they did IVF, Baruch Hashem, and they had a whole bunch of children, beautiful mishpacha, and that's it. They're done. Whatever it is, she's too old, they can't have any more. Maybe with C-sections, they can't afford it. Each one is $30,000+. I don't know, whatever it may be. This is where they're holding. They had 3, 4, 5 kids, this way, and this is where they're holding. But Lamaisa, first of all, let's say there's zera. It's still frozen. What do you do with the zera? Is it levatala now that they should throw out the zera? What about the embryos? What if they have, embryos? What do you do with those? So again, I was makabel from my Rabbi Ritzuk Berkowitz. Two things. First of all, when it comes to the zera, the whole isser, again, the whole isser is being mitzi the zera levatala. Once the zera came out in a kosher way, right, what happens to it afterwards is really inconsequential. And the mela, if they want to dispose of it, they can dispose of it. Usually it costs money. Every year you want to keep it frozen, it costs money. So if you stop paying for it and they want to dispose of it, they could dispose of it. I think you should just tell them to be makar that you don't want them to use it for other projects, because otherwise they can't do that. And nobody wants to have extra children or whatever running around. So no, it could be a real yichus. It could be a mess, and a real mess with yichus and things like that. Who knows? Think about it. Well, zera. The truth is, actually, zera could be again get a pest. If it's yichus, really again goes for Yiddishkeit, goes after the woman. But what if she was Jewish? It could get messy. You could figure out a way. It could get messy. So rather, you just want to have them dispose of that. And similarly, the Bais can say that the embryos don't have a din nefesh, and therefore, when a person is done, the same thing. They should not be using them for other things. But he's not mechuyev to pay that it should be frozen la'ad v'lo mi'olamim. Once they are finished, with whatever they can afford, or whatever, for whatever reason, this is what they're doing family-wise, and they can't do any more, it would be mutter to tell them, to stop paying for it, as long as it's being disposed of in a way that would not cause any yichus shailas. That would be okay. Again, that's what I was makabel from my Rabbi Berkowitz. Okay, I guess that concludes this fertility and halacha shir. Again, there are other shilas, about sperm donation and egg donation, which are big shilas in halacha. Of course, everyone should ask shilah if it's negel lamaisa, but maybe at a different time we could discuss those. Shkayach, everybody. Thank you for coming.